As a healthcare professional, you're going to have to interact with a variety of different people. Therefore, a key skill you're going to need is to be able to adapt your communication accordingly to provide the best possible service and care for your patients. Consultations for Health, helping you progress in communication skills to optimise the care of your patients. Our mini-series, Talking To, looks at specific situations to help build upon skills formed from our Consultations basics to guide you through some common scenarios you may encounter. This video will be focused on talking to patients who may be non-adherent, where we'll utilise motivational interviewing approaches. There is a brief overview of motivational interviewing on Consultations for Health based on the book Motivational Interviewing in Healthcare. Be sure to check it out in the link below for more information. You may find trying to change a patient's behaviour in the interest of their health is challenging. This is because, as healthcare professionals, we are equipped with the knowledge to understand why change needs to happen. But this may not be apparent to our patients, especially if the change may disrupt their existing routine. Motivating a patient to change a behaviour is not the same as telling them what to do. Instead, it is to help them to admit a change needs to occur. Listening is a key skill here. This does not mean asking a few questions and repeating what they have said, but actively recognising their opinion and affirming it. Look out and use change language, which can be remembered through the acronym DARNS. Desire, ability, reason, need, and finally, steps taken. The patient is likely to show ambivalence or conflicting beliefs about their health. This is great, as it helps us to understand them, since they are voicing their thoughts. Try not to show any judgment if they are justifying any bad habits. It is critical during this time to not give any criticism or advice, as this could deter your patient from confiding in you. Try to listen as much as you will inform. Try to use an appropriate mixture of open and possibly closed questions. Open questions are fantastic at encouraging the patient to speak their mind, which gives you the opportunity to gather that rich information which will help make the rest of the consultation a little easier. Getting them to provide a list of pros and cons is a great method to do this. Closed questions, on the other hand, can be tailored to encourage the patient to elaborate on specific topics. One approach which can help you understand where your patient is towards a behaviour change is to use the ruler method. Place a scale on a statement and it will give you a great indicator of where the patient feels they are. Let's look at a scenario where we use these techniques.
This patient has been referred to her local stop smoking service.
Hi there, is it Kelly?
Yeah, it's Kelly.
Hi, my name's Sophie. I believe I'm here today to talk to you about giving up smoking.
Sounds about right.
Yeah, not a problem. So, just to double check, can I confirm your address?
Yeah, it's 14 Flat Bays.
Brilliant. I'm talking to the right person. So, just before we get started, can you tell me a little bit about how you've been referred to us here today?
Yeah, so I went to the GP, complained about breathlessness, and they sort of were talking about my smoking habits. I'm smoking about a pack a day, and they sort of saw real concern with that. They sort of referred me and urged me to sort of speak to someone about it.
Okay, so just to double check, you went to the doctors about breathlessness and they've told you to come in here today?
Yeah.
Yeah, okay. How do you feel about coming in today?
Well, I mean, if it's affecting my health, I guess I should be doing something about it. But, you know, a lot of my friends do smoke and none of them have health issues. So don't really know what to do because smoking is a big part of my life, so
okay.
Yeah.
You said that you feel the doctors say that smoking's affecting your health. Do you feel that smoking's affecting your health?
I mean, I can see it affecting me because I do get breathlessness, and over the couple of years I have increased my smoking, so with that I've become more breathless. So I can see that those two are linked. and I am starting to sort of not be able to run a lot and do more exercise, so I can see why I do need to stop. But like I said, it's just so hard.
Is there anything that makes it particularly hard to give up?
Yeah, so I rely on smoking for stress. So I work a really hectic job, 9 to 5. Every time I have a break, I just go out and smoke, just because it just relieves, it calms me down. And I ought to find something else. And I wish I could, but it's just difficult to when I barely have any time to do anything else.
Okay, so just to double check I've got the right picture again. So you're aware of sort of why smoking's bad, or you can see why you need to stop, but it's that kind of push and pull of I want to stop because of things like running and being active, but you also want that stress relief when you're at work.
Yeah.
Okay, so going back to work and stress, on a scale of 1 to 10, sort of 10 being fully dependent, can't live without it, how much would you say you rely on smoking for stress?
I want to be at like a 3 or 4, but
Okay.
I'm definitely higher, about a 7.
Okay, so a 7's quite not a 3, they're very different, but at least you're not at a 10,
Yeah.
which says to me that maybe there are other ways you manage stress, or...
Yeah, I mean, I really do want to lose weight, and that's one of the biggest things that I guess made me come here, because if I'm unable to run or exercise because I'm becoming breathless, how am I supposed to lose weight? And with that being said, like, I have tried to stop smoking for the same reason, but I've just gone back to it, and I just sort of, I guess I need some advice and help, really.
Yeah, absolutely. So I can see for you that it's kind of a knock-on effect of sort of...
100%.
Yeah, that smoking sort of causes one thing like the breathlessness, and it causes everything else to sort of fall out of place. And that's why you're here today.
Yeah.
I think given the amount that you've spoken about wanting to change, I really think that we'll be able to work with you and help you. If you're able to stay for sort of an extra 5 minutes, I'd love to go through some tools that you can take home and use sort of starting today, if that's how you feel.
That sounds great.
We hope you have found this video helpful, and we would appreciate any feedback in the comments below. This video is only designed to touch the surface of talking to non-adherent patients, helping you to have a foundation to build from in your future practice. Thank you for watching Consultations for Health. Feel free to check out our Facebook, Twitter and other YouTube videos. Don't forget to like, comment and subscribe for more videos in the future.